Hi everyone, Ryan Duffy here from Precision Microbes, and welcome back to Tech in 10, our weekly 10-minute series where we detail key veterinary topics.
Yeah, kind of timely ones. This week it's grass tetany. Hi, I'm Tommy Heffernan, grass tetany, hypomagnesium. So the clock starts now. We've 10 minutes. Ryan, grass tetany, hypomagnesium, grass staggers. What is it?
Yeah, it's a metabolic disease that's affecting predominantly dairy cows, suckler cows, and even sometimes even in sheep, where it's characterized by low magnesium levels in the blood.
So magnesium, what does it do? When you have low issues, we get low magnesium, it's important that it's actually involved in many functions. It's a kind of a buzzword at the moment in humans as well, I take it. Apparently it calms you down. Nerve function, nerve function, Ryan. Talk about magnesium and nerve function. That's why we see some of the symptoms, isn't it?
Yeah, well, it's involved in that sort of transmission from nerves to muscles. So if we have low magnesium, it actually excites everything, because if at normal levels it's calming everything down. As we said, it doesn't clearly work for you, but it certainly calms things down. So whenever we start seeing deficiency, animals start getting a wee bit more irritable and excitable.
Okay, the cows and sheep don't store it, so they don't have a store, do they?
No, generally they don't have much of it. There's a wee bit in the bone, but it's not liberated to the same level the likes of calcium would be. With milk fever and stuff. So practically they don't really have any store. So we're completely dependent on intakes.
Milking cows as well, you're hitting peak lactation, so magnesium output is higher. So that's why your risk with dairy cows is around now. Sucklers tend to be a little bit later. So two presentations, subclinical and clinical. So subclinical is, you don't see the usual things you see with it, but these ones you really want to be mindful. We're in the risk period. Changes in behaviour, cows that are tremoring, excitable, they actually are quite dangerous. I've been attacked by one or two of them in practice years ago. Anything unusual this time of year, obviously working with your own vet, you need to be considering anything sort of nervous or head related. I would always say subclinical grass tetany should factor in. But people are familiar with the clinical, Ryan, when you talk about the clinical presentation.
Yeah, sort of really shaky cows, again, just think of it with nerve and muscles starting to get really shaky. Most people would kind of associate it more so with cows being down, paddling, maybe in the middle of the night or after very bad weather, stuff like that.
And you don't have much time. 8 to 12 hours is a lot of time with these, so they're a true veterinary emergency. Often they're found dead. You can, sometimes people want to know what caused the downer cow to die from a prevention point of view. You can, bloods are not very useful. You can take fluid from the eye, can't you, the cow?
You can, and it's very, very reliable.
We might cover down cow management again, but when we think about treatment, these cows often have a little bit of milk fever, hypocalcemia as well, don't they? Why would that be?
Yeah, so again, hypocalcemia is another metabolic disease, so it's a sister nearly of grass tetany.
Okay.
But the one thing about milk fever is we know that we can boost calcium absorption with magnesium. It's involved in the absorption of calcium. So naturally, if we have low levels of magnesium, we're going to have low levels of calcium. So it's definitely another supportive treatment to go alongside grass tetany treatments.
I said suckler cows tend to get a bit later. Dairy cows, now you're in the peak risk period. More at weaning time. Treatments, again, you work with your own vet. Injectable calcium, you want to be incredibly careful about magnesium going to the veins. Vet, this is something only vets should do, really, isn't it?
Oh, definitely. I know a lot of people will top the calcium thing up and give them simultaneously, but that can kill animals very, very easily.
Again, magnesium under the skin. So people are kind of familiar with treatments, familiar with clinical signs. Why at this time of year, you like your metabolic diseases, why at this time of year is it such a risk? Why do we need to be proactive here? And then we'll talk about prevention.
Yeah, well, metabolic diseases, they're a mismatch between inputs and outputs.
Okay.
You've kind of already alluded to outputs, high levels of milk, particularly around peak, that can increase the amount of magnesium that's being exported from the body, and we know that there's no storage. So in respect to inputs, how much the animal is actually taking in and how much it's absorbing, two very, very different aspects of input. So we have to look at both. Intakes can be reduced during bad weather. Voluntary dry matter intake naturally does go down with poor weather.
So that's where you'll be more observant for clinical cases. You keep your eye out more during inclement weather.
Definitely. Diseases even, if cows have mastitis or anything floating around, that's going to reduce their intakes too. So they could even be more prone to taking the likes of grass tetany. Now that's the intake side of things. Absorption on the other side, there's a variety of things which will actually bind magnesium up in the rumen.
Okay.
I'm sure you'd have plenty of experience with, it'd be high potash fertilizers,
Low sodium is mentioned. Ammonia and nitrogen, high nitrogen. So ammonia can bind up magnesium, can't it, as well, the rumen?
Yes, exactly. So the likes of potassium and nitrogen or ammonia can bind it up and make it practically unabsorbable. So that's a big no-no. So if we actually do look at what our cows are eating right now, lush, rapidly growing spring grass, what's the issue with it? Well, if we even go back to our video, which you can all refer back to, like some summer scour syndrome, we have low magnesium in there. We have practically very little physically effective fiber. We have high moisture, and all of that is kind of resulting in rapid gut transit and lack of absorption of magnesium. There's only a very little amount of it. So if it's going through the rumen very quickly, we're already cornered, let alone if we have antagonists like potassium, which are going to bind it up, nitrogen, which is going to bind it up, and if we don't have enough sodium, that is involved in the whole absorption of the thing. So if we don't have enough sodium, we're not going to absorb it either.
So for dairy cows now, this is the risk period. You've got to look at supplementation. May, definitely. June being the key time, but all summer probably a risk. Anytime you probably have disease or issues with cows, it's something you need to think about. So most farms will be familiar now that, look, this is the amount of dry matter or percentage dry matter of magnesium that's in lush grass. All these risk factors here. Daily supplementation is probably something most farms need to look at. Talk about kind of the requirements.
Well, dairy cows, they need 30 grams per head per day. Suckler cows would need 30 grams per head per day, a wee bit less for sheep. But a lot of the dairy men will be feeding it in their meal. Either they'll know that or it'll be inadvertently included in meal. So a lot of the time we'll get over that by giving them enough concentrates in the parlour. But other ways of supplementing it would be licks, like the salts, maybe even putting it into the water and mag chloride and boluses.
So I would have found water treatments work well once they're regulated and done properly. Bolus is probably something that the suckler cow does. You know, your suckler cows, of course, pre-weaning work well. Licks, just make sure it's bioavailable. It's usually magnesium oxide people are putting in on licks, isn't it?
Yes.
And mag chloride through water. So again, just making sure it's palatable and it's bioavailable.
Well, that's it. Like the palatability is one of the concerns with the likes of licks, particularly with mag oxide. But a lot of these licks will include the likes of molasses, which will make it palatable.
Looking at the weather and looking at grass growth at the moment, I would say we're probably heading into the peak risk period for grass tetany now. So be aware that all these risks are on most farms, I would say. Supplementation is key, ensuring you're getting enough per head per day, and then watching for these subclinical cases, acting early. Clinical cases, veterinary emergency, quick. Talk to your own vet. Just in future trends around grass tetany, hypomagnesemia, because it is a challenge. Probably, some of the grazing challenges we see, there's always risk and reward. We're getting very good at growing grass. One of the things then is you see a little bit of this. Mixed species swards where you have more magnesium is probably something. Thoughts on milk monitoring for magnesium at herd level. And I think just one thing I always mention, the collars and the boluses. We're doing a lot of work with cows at the moment, very exciting. A lot of it probably related to offsetting some of these as well, because we're targeting rumen health. But we're looking at the collars from a data point of view. Mm-hmm. From a positive perspective, but equally so, collars and boluses can be very useful when we're monitoring metabolic and herd health.
But if we go back to the very principle of what is happening, neuromuscular function, these are starting to go awry, and these likes of collars are going to pretty much tell us that there's something going on, because there's muscles in the rumen, they're going to be impacted. So collars, definitely a valuable tool, particularly in those sort of high risk periods where we're hitting peak 1 to 2 months out on grass that's lush. Definitely something to invest in and to look forward to.
Okay, main thing is be aware, watch those clinical cases, understand how magnesium works, supplement with care. And again, I mentioned cow trials there. It's a very exciting time for us. We're seeing some really nice data coming back from cow trials. Any last comments, Ryan? We're coming well into our time today. We're getting quicker and better.
We're getting really good at this. No, that's pretty much it. Like, those are the risk factors. These are the preventative strategies, the treatment strategies. Going back to what you're saying, it really is a veterinary emergency. You need to be really on top of this whenever you start seeing clinical signs of it. So, I think we've covered it all.
So, Tech and 10, we're going to cover a topic each week. If you have a topic you want us to cover, it doesn't have to be always related. Like, this is not really related to precision microbes. So, if it's not related to precision microbes, that's fine. We want to cover a technical topic each week. So, you let us know.
Put them in the comments below and we will do it.
Excellent. Thanks for listening.
Brilliant. Thank you.